And welcome everyone to SVA's COVID-19 surveys, how survey data drives policy and action breakout session. A little bit different, a little bit new this year, coming to you virtually from the DC area. Hope everyone is doing well. Good morning, afternoon, or evening, depending on where you are in the world watching us. We're really excited for this presentation because for a long time we've talked about how SVA is a data-driven organization, and that pertains also to public policy, public advocacy, and government affairs. And we've never had the chance to actually show what that looks like and give an example of that until this year with COVID-19. So with myself and co-presenter Lauren, VP of Government Affairs, we are happy to present this and kind of let you see behind the curtain, so to speak, to see how research and government affairs works together to help promote data-driven policymaking at the Capitol and with the federal agencies. The one thing that I do want to acknowledge is our teams. If I don't do it now, I'm going to forget because I'm going to get so excited going through this presentation with everyone. And that's Neo, Austin, Cameron, and Madeline on my side, and Lauren and Justin H and Justin M in the government affairs wing. So we may be presenting, but they also do a lot of the work that happens behind the scenes, and don't want to forget to acknowledge them and their hard work. Just a couple of housekeeping items before we get into this. There is a Q&A box at the bottom or just below us. Please feel free to submit any questions. We'll have time at the end to answer any questions that you may have as we go through this. And the chat room, be professional and respectful to others. And with that, we can get started with the presentation. First off, quick introduction. I'm Dr. Chris Andrew Cates with SVA, Vice President of Research. I've been with the organization since 2010. This is my 11th NACON. Somebody asked me and I had to do the counting earlier today before I responded. Principal investigator for Mailing Records Project and the INVEST project, and been doing research for about 18 years now, survey research, quantitative, qualitative research. So been doing this a little bit of a while now. I'll turn it over to Lauren to have her introduce herself.
Thanks, Dr. Kate. My name is Lauren Augustine, and I'm SVA's Vice President of Government Affairs. So I oversee our policy and legislative work with, as Dr. Kate mentioned, the Justins, Justin Hochschild, Justin Monk, and Austin, who are here with us today in the chat and the questions. So make sure you say hi to them. Looking forward to today's discussion. Unlike Dr. Kate, this is only my 4th NatCon. So still new in his eyes, but I have really enjoyed my time with the team and working on behalf of all of our chapter leaders in Washington, and hope to continue doing so and hope to get great ideas from you guys for what we can work on moving forward.
Maybe new compared to me, Lauren, but you have a lot of experience and wisdom that I rely on. So I appreciate you being on the team.
We are a good team, Dr. Kate and I. He tells me what I should work on. I take it to the Hill. They pass laws. We've got a good thing going. And
the only thing I'd add to that is that the only reason why I can tell her what we need to work on is from you in the audience and the student veterans. So this is going to show you how we do it. A little bit of the agenda introductions. We can cross that off. Yay, we got through the first step. We'll touch a little bit on the overview of data-driven decision-making, what that is, kind of give a primer. I'm going to spend some time on the data side, so how we collect the data, do some, and that analysis and present some findings from our COVID-19 survey series that we did last spring through the summer. Then turn it over to Lauren to talk about the policy side, and I'm eager to learn what she does with all the data after we give it to her team. Talk a little about the future direction of how we work and how we collect the data and use the data. And then we'll end the breakout session with a Q&A discussion. So with that, let's dive into data-driven policymaking. So this is a very, very simplified version of the process. And what it usually happens is that there's a discussion, whether it's at the capital level or the grassroots level or somewhere in between with VSOs or within the executive branch. There's usually a discussion about a policy or a needed policy, something that needs to happen that's either missing or needs to be revised or modernized, so on and so forth. And so through that discussion, the new policy is created, whether that's a law or a change in regulations, so on and so forth. That new policy is formed and implemented in the third step. And that's usually when everyone tends to feel what the policy is. It's putting that idea into practice, and that's the effect it has on everybody's lives, which moves to the impact. Once the impact by the people are being once that impact is being felt, then that's where the research can come in. That's where we can begin to learn, is the policy a positive thing? Is it a negative thing? Is it neutral? Does it even, is it even being felt, or is it being felt in the way that was intended? Then that data goes back and informs the discussion, and it kind of goes through that system all over again. Again, that's a very simplified and straightforward process of the questions, or of the process. Let's take a look at an example. So one example was the INVEST project. We looked at the goal of the project was to look at how well student veterans were doing academically in college using the GI Bill, specifically the post 9/11 GI Bill, because we were starting to get questions of, are student veterans graduating? Are they using it to earn their degree and join the workforce, so on and so forth. So once that project was done and the results were known, that informed the discussions on the Hill with the VA as well as other stakeholder groups. The next was the GI Bill changes that were both talked about, approved, voted on, and implemented. And that was an example. Here's the thing though, and this is where it can sometimes seem like it's taken a long time. When you look at the timeline, the INVEST project started in 2015. The results were finished late 2016, early 2017. That's when the discussion was happening. That's when the GI Bill changes happened. INVEST project was not the sole thing that was going on with the discussions and changes, or a lot of other things, but there was a component in all that discussion and changes, but the implementation didn't happen until 2018. The Comary Education Act was signed in late 2017, but the implementations didn't start until 2018. So you can see that for big projects like INVEST, it sometimes takes a while for the discussion, changes, and implementation to work and move into effect. So the big question that we had when we were thinking about this was, how can we reduce that time? How can we get more real-time action and knowledge from student veterans to the policymakers, and how can we be that bridge to it? And that's when we started thinking about public opinion research and how best to apply to that. Now you may be asking, what is public opinion research? It's basically using a sample to represent the population and to measure the opinions or concerns or the issues that are affecting that population. There's a lot of different modeling. There's a lot of different statistics. If we were in research conference, I'd be going into all that. I won't bore you with that, but unless you want to know, if you want to know, just reach out to me and we can talk about the different methodologies and modeling for that. You have probably seen a lot of public opinion research. Most common are approval ratings for politicians, president, Congress, so on and so forth. But there's also other types of public opinion research, engagement, thought, feelings towards military actions, or cultural issues, so on and so forth. The slide you see right now are just a couple of the many different public opinion researchers and research agencies that are out there that does work, as well as some of the things that they have produced. But when we were looking into public opinion research, we noticed something. We noticed that there was a missing piece in a lot of the public opinion research, and that was veteran topics and concerns. The great thing about public opinion research is that it is done routinely, and so you can really see minute changes over time. And when we looked at public opinion research through the lens of veteran topics and concerns, we didn't find much. What we found was very sparse topics every now and then. Usually when it was a big change to the GI Bill, like the post 9/11 GI Bill had a lot of public opinion research out there, but not anything more recent or more topical. So we realized that there was a missing piece in all of this that we could develop and use to better hear from the veteran community and student veterans and be able to provide that information to policymakers and stakeholders. And so that's how the Veteran Opinion Survey was developed and formed. It's actually a longer process and all that. It's actually been in development for about 3 to 4 years now. The idea behind it is that we are able to reach out to a sample of the veteran population and get their opinions and thoughts on policies or things happening in the veterans community, and be able to share that data and information, like I said, with the policymakers and stakeholders. It's rather unique and it's rather new to the community. I don't know of any other organization that is doing this on a routine basis, and it has already provided some fruitful fruits in this. We were originally going to launch it last spring, around March and April, but COVID happened. And instead of scrapping the idea altogether, what we did was we took that idea and just focused it in on COVID-19. And we had renamed it quickly as the SVA COVID-19 series. Were 5 specific surveys on COVID done between March and June. We're still asking questions about COVID because COVID is still a important topic, but we folded it into the larger Veteran Opinion Survey. These are the results that I'll be getting to here in a couple of slides. But what we were focusing in on for this one specifically were the behavior, academic, economic, and healthcare impacts of the COVID pandemic was having on student veterans and the larger veteran community. So what we look for in the results, not only for the COVID-19 series, but just public opinion research in general, agreement. If the results are similar to other larger populations, then that's usually depending on the question, it's a good sign because it speaks to the strength and validity of the data, but it also allows us to know what where veterans and the larger American society are agreeing upon certain issues and topics. Disagreement, this is also important because if there is a difference between veterans and the larger American population, this is also good to know so we can have better data and information for that topic. Trends, results that change over time. These are usually good to see if there's a cataclysmic event that happens that changes people's perceptions or opinions. If we had started 2 years ago, we'd probably have a good indication of how COVID-19 has impacted a lot more of veterans' lives than we already do. But this also means that we can better understand the recovery from COVID-19 once it is behind us. And then finally, common themes, topics, or opinions that themes. These are the common topics and opinions that reoccur throughout several surveys and results. So now we're going to get into the results of COVID-19, and the first one that we're going to look at is changes in behavior due to COVID-19. One of the big questions that we were faced with at the beginning was, are student veterans and the larger veterans community following the guidelines by CDC and health professionals about what to do to protect themselves and reduce behaviors connected to transmission? Back in March, one of our first surveys, first questions, we were asking about changes in behavior due to COVID-19. As you can see from this, the positive behaviors, hand washing, hand sanitizer, and social distancing were increased, and the more transmissionable behaviors like shaking hands and attending in-person events were decreasing. So that was good information for us to know that the messaging campaigns on what to do to reduce the spread and protect yourself was being heard by the veteran community. And next, we asked, where do people go when they get sick or someone in the household gets sick? As we all remember, a year ago, there was a lot of concern about the healthcare system being overwhelmed, surges in hospital visits, and worries about bed capacity. This one, we were really interested in how many were going to VA medical centers as a way to kind of get a sense of the potentiality for that being impacted on the VA health system. There was a lot of conversation about the public health systems. VA was kind of a distant second in all those discussions. But also what we were curious about was the fourth option, the campus student health centers with schools closing, and if that was their only avenue for healthcare, what was that going to be like for both the schools, but also for the individual? So we wanted to capture that as well. Going on to the economy, we asked about the feelings of the impact on the economy. Hopefully the colors are coming out pretty well through the webinar presentation. We asked simple question. This is something similar that you'll see in other public opinion research. What do they think the impact COVID-19 will have on the economy? Negative, positive, no impact, not sure. This was from the earliest one, so this was from March, April, and June, so this is a little bit of a trend. There was pretty much consistent across the board that COVID-19 would have a negative impact on the economy. This is good because it allowed us to kind of get a sense of the level of anxiety and worry that veterans and student veterans were having about the economy, wages, job opportunities, so on and so forth. So this helps in those conversations as well. What we also want to know, we had a follow-up question with that, which was how long did they think the negative impact to the economy would last? So this was only for that subgroup, that 90% of the sample that asked, that said the economy COVID was going to negatively impact the economy. And again, this is a little bit of a trend: March, April, and June, blue, orange, and gray. What was interesting in this and really provided some insight was that the more people over time saw this as being more of a lingering impact. You see on the far right, more than a year, about 40% in March of last year thought it was going to last for more than a year. But by June, 3 months later, it was nearly 3/4. So an increase of nearly 100%. It nearly doubled in those 3 weeks, which is very important for policymakers and stakeholders to know, because that tells a little bit about the fears of a sluggish economy and jobs and wages. Of course, student veterans are who we work with, so we definitely wanted to talk about and gain insight into how COVID-19 was affecting them. This is from March of last year, one of our first surveys that went out for COVID-19, and we wanted to know just the magnitude of the disruption. COVID-19 hit pretty quickly, and schools, colleges, universities had to scramble to adapt and protect the students. So we asked, how big is the impact? Is it just in certain regions, or is it nationwide? As you can see, nearly 3/4, so 3 out of every 4 student veterans, their school closed and they moved everything to online classes. And Lauren's going to most likely talk about this later, what that meant to a lot of the policy and regulations and accreditations and approvals that VA had in place that needed to change nearly overnight. And was in the office with her. We were remote by that time, but still, it was an energetic time. I'll say. I'll let Lauren use her own descriptors, but it was very busy. Well, and then the next question related to that is how student veterans thought of what COVID-19 would impact their academic goals. We had already asked about the economy, but now we wanted to make it a little bit more personal and a little bit more focused, and talk about how they felt this would impact their goals. Because with classes going online, could they get the classes if it's a lab, or if it had to be done on campus? Things like that were we needed to know, so we could help explain that to policymakers and stakeholders. So there's different ways to slice this data. The one way that I usually do it is just looking at those that had no worries at all versus those that had at least some worries. When you do that, it's a big majority, almost a super majority of student veterans having at least some worry. So there's some anxiety about either a delay or having to withdraw for a certain amount of time, but some worry that COVID-19 would negatively impact their academic progress and goals. And then you can go all the way over to the left, which is the extremely worried, and kind of see that anywhere between 1 in 4, 1 in 5 student veterans were extremely worried. And that's an important number to think about. In a regular class, that's 4 or 5 people that could be impacted in a class of 25 to 30. We also use the Veterans Opinion Survey to get a sense of what policies and what are the priorities that student veterans and the veteran community think that VSOs, SVA, Congress, the administration should be focusing on. This is actually from our most recent one last month. We timed it for the new administration coming in to see what the community thinks that SVA's policy priorities should be and should focus on over the next 3 months. Not too much of a surprise, but education and education benefits were at the top. Veteran support, mental health opportunities, and COVID round out the top 7 of that. The word montage is there at the left. You can see what words and phrases stand out. There's a lot more to the COVID-19 surveys that's barely scratched the surface on it. We'll talk more about how to access them and the future direction that this is going here in a couple minutes, but I'm going to turn this over to Lauren to talk about how the government affairs team used all this data to affect good change.
Thank you so much, Dr. Kate. So we have all this great data. Now what? What does it mean? What do we do with it? Does it do anything for us? What do we use it for? And the answer is a lot. We use it for SVA as a whole. I think a great example of that, as you saw on the previous slide, mental health was something that was noted as one of the top things SVA should be focusing on. We incorporated a lot of well-being and mental health conversations into NatCon based on some of that feedback. A lot of this plays out in the policy world, as Dr. Kate has hinted at many times, and it really directs the government affairs work in terms of what should we be focusing on? What stories do we need to bring to the Hill? What things do we need to bring to the VA's attention? And I think COVID and the survey results from our COVID surveys has really been a prime example of how we turn your words into action in Washington. I'll tell what is now a funny story. At the time did not feel like a funny story. But as Dr. Kate alluded to, early in March, mid-March-ish, we had Washington Week in early March, and then everything shut down. That was the last time we got to see really anybody from SVA or any chapter leaders was Washington Week. And then right after, the world turned upside down. And we started these surveys, and sort of simultaneously, we were hearing back from the surveys that people were switching to online classes, and we were getting questions directly to us about whether or not that was going to impact housing rates. As of right now, there is an online housing rate versus an in-resident housing rate, and there's some discrepancies in what those pay out at. So we looked on the VA website, and there was a line on there that said, as long as you attend class one day in person, you get the in-resident rate. So we were like, cool, good, yes, solid. Everybody is good to go, easy day. On the intro slide, you might have noticed that I've been around the block in the veteran advocacy world since around 2013. And so I knew better than to just trust the VA website at face value. Very good information, but oftentimes things are a lot more nuanced than what a website can share. So reached out to VA and said, hey, your website says this. We are getting flooded with both survey responses and questions about the switch to online learning, double checking that everybody is good. And the VA was like, funny story, no. If they were in a class that was approved as a hybrid, so in person one day, online the rest of the semester, no problem. if they were approved for a class that was supposed to be in person the whole semester and then switched to online. Not quite. So after seeing the survey response come in, where we had upwards of 80% of people who were switched to online only classes unexpectedly, and the flood of schools we were tracking just on our own, we said, yeah, this is a big problem. And we took it to Capitol Hill, and we went from problem identified to law signed protecting in resident housing rates regardless of the online switch in about 10 days. Which would be a super cool case study for a political science class down the road. But in the moment, it kind of felt like chaos. So we got it done. And it was truly because of the feedback we were getting from chapter leaders in the survey and directly to us as a team. So a really great practical example of where you sharing and talking with us through these surveys can help impact some of our like quick thinking, quick reaction force type work when it relates to policy. I think another great example I'll give that's COVID specific is around some of the fears with economy and access to jobs. In the survey that we were getting, a weird little hiccup, I'll call it, let's call it a hiccup, with collecting or with unemployment is that if you are a recently transitioned veteran, so within 18 months of leaving the active duty service, you use the GI Bill, I should caveat that, and you're using the GI Bill, you can technically, in normal times, 2019, we'll call it, are not eligible to also file for unemployment. Now, in one of the original COVID relief bills that we saw come through Congress, there was a provision in there that sort of lifted a lot of the restrictions for other categories of the population. And knowing that access to jobs and the economy were such a high stressor from our surveys, we reached out to the Department of Labor and said, hey, can we just give some assurance? We know this is a stressor. Can we let folks know that they are good to go when it comes to unemployment because of this COVID relief bill? And again, they were like, great question. We'll get back to you. Turns out everything was fine in the end. They were covered, but it wasn't an explicitly outlined population that was sort of relieved of their normal restrictions. And we only knew to ask because we were getting that feedback from chapter leaders, again, both in the survey and from direct feedback. So I think that those are two great examples. The surveys since then have gone on to tell us that we need to keep at it when it comes to COVID relief legislation. We made sure to extend the existing protections through December 2021. Keep taking the surveys to let us know if we need to advocate for that to go longer. I am hoping, fingers crossed, toes crossed, that we are back to some semblance of normal life before December 2021. But, I think if we had all asked a year ago, if we thought we would be here now, none of us would say yes. So I'm never going to count my chickens before they hatch again. But that was another great, continue to tell us what to work on. And we know how far we need to push things, when we need to push things. It's just a really good barometer for what we should be talking about. I think another great example of what we've been able to do is not quite so linear, but within the surveys, there's also some information that we asked about the importance of access to the internet or access to broadband and other technology things. And as we sit in a virtual conference, I obviously very high response rates on the importance of those things, which told us that we needed to start engaging on supporting greater access to broadband, supporting efforts to make sure that all households could have technology and could have internet to be able to access online learning, online work environments. And so not something that's in our normal portfolio, not something we would have probably really thought to dig in on a year and a half ago, but the survey says to do it. So we did. Those are some great examples. I think, if I could encourage anything, it's that we as a government affairs team truly try to take our direction from you, whether that's direct feedback or through these types of surveys. And so the more robust we can have those surveys become, the more you engage with them, the more we know what we need to work on for you. So keep at it. The other plug that I'll give is that if this is really firing you up and you want to also engage, we do have a lovely program called the Policy Liaison Program that's led by Justin Monk. And if you are interested in that, ask about it in the chat. I have a strong feeling he'll be able to help point you in the right direction there.
Thank you, Lauren. Want to close up before we get to the questions, seeing a lot of questions coming in. Looking forward to responding to those. But really quick, right before that, future of the Veterans Opinion Survey. So like I said, what we've done is take the COVID-19 survey questions and melded it into the larger Veteran Opinion Survey. So we're still collecting and getting the trend data from that. But we are expanding it to include some more of the traditional public opinion research topics and questions. Currently, we're looking at releasing a survey into the field about every 5 to 6 weeks. That seems to be the perfect amount of time so that we don't overload student veterans with too many surveys, but also enough time to track any changes in opinions or topics that we need. I'm preempting a question that I saw asked. These results will be on SVA's website. We're putting the final touches on the narrative reports, but also we're looking at putting together some dashboards, interactive, that we are that will allow anybody to kind of look and explore the data and potentially answer questions that they may have, and then just grow the Veteran Opinion Survey. So the panel in and of itself is an opt-in. We ask for volunteers to come in and be part of the panel that we then send out the surveys to. If you are interested in either the results or the sign up, we have 2 QR codes. The one on the left will go to the Government Affairs webpage. Nothing there yet, but you can bookmark it and check back, as well as look into the Public Liaison Program, as well as other opportunities to work with Government Affairs. The one on the right is the form to sign up for the Veterans Opinion Survey. You can also update your contact information there as well. Just make sure towards the bottom it asks the opt-in question of joining the Veterans Opinion Survey. Say yes, and you will get the next round of Veteran Opinion Surveys. And with that, I'll leave this up so people can scan the QR codes, and we'll go to some questions.
We do have a couple, Dr. Kate, that focus on sort of a two-prong question here. I can take part of it, but I think you can take the first half of it.
Okay.
Have we seen any data come through about National Guard activation versus active duty, and what sort of impact that is having on policy? I can take the second half if you take the first half.
Sure. As for the first half on National Guard activations, not a lot, because there was in part, there not to get super survey statistical, there just wasn't enough guardsmen and reserve persons in the sample for us to glean any reliable data to report. We're hoping that changes over time as we build and expand the survey panel.
Great. And from a policy standpoint, easy answer, absolutely. Not only have we heard directly from guardsmen well before the last year affected activations in response to COVID, but right now we know that there's some frustrations with protections for GI Bill students when they're activated as guardsmen. And so we've been actively working with the Senate Veterans Affairs Committee in particular on addressing what the scope of the problem is, and then more importantly, what can be done legislatively to address those concerns. It gets a little tricky. It's not quite as cut and dry as an employer, but we are actively working through that issue with Congress, and encourage you to sign up to take the survey so that we do have better data to point to the need. I mean, they're more than willing to engage in the conversation, but the better data we have, the stronger our argument is. So please do sign up to take the survey so we can showcase why it's a worthy conversation.
Lauren, I have a question for you.
Ooh, let's hear it.
When you take this data on the Hill and present it to staffers and the VA and the executive branch, what are their reactions to it? Are they surprised? Are they happy? Are they worried?
Yeah. Fantastic question. First and foremost, thankful. Much like SVA, Policymakers and policy leaders want to be data driven as much as they can. And sometimes that's really hard to get and hard to find. And so they oftentimes have to rely on anecdote. So anytime we've been able to bring them data, they are like, thank you, thank you, thank you. And then it really helps to, more than anything, cut through the noise of Washington. Everybody is up there trying to get their voice heard. Everybody is up there trying to be a good representative of their population. Literally everybody has a lobbyist, but the more effective ones come with good data, and that helps us become really effective in our lobby efforts. So just all around thankful, and it helps us cut through the noise. Dr. Kate, I have a question for you.
Shoot.
This is a little BTS behind the scenes question,
Yeah.
but I think it's a good conversation. I know that you have had a lot of interest from the VA. It's not just Capitol Hill and us
Yep.
taking these issues to them. You've had a lot of interest from the VA itself on how they can partner to better understand student veterans, what we're hearing, and also test some of the things that they're hearing. Do you want to talk about that a little bit?
Sure, I'd love to. One of my driving philosophies when it comes to research is that research should inform data. Data should inform policy, not the other way around. And I think that's a big misnomer mistake that people tend to think that policy decisions are made from already known answers. So, and what they do is they look for data to support that answer. It's called confirmation bias. But what's more and more happening more and more is that VA, Congress, they're all hungry for this data, as you said, and so they're happy and thankful that they're able to kind of pick our brains, but also engage them in conversations of what they need to know in the future to make better policies, or not be surprised when something happens and they don't know. So it's been a great partnership, but I would say that the data is driving that policy in that circle that we show at the beginning.
Great. And that's actually a perfect lead into what I think will need to be our last question as we wrap up here. But SVA has long been known for our research. What's next from a research perspective, and what is our top policy priority for the 117th Congress? I'll let you take that first one.
So just spending in areas that we never thought of. Later on this summer, we're going to be looking at both the workforce, veterans in the workforce, and their financial acumen, so to speak. What are they saving? Do they have a house? Are they preparing themselves for their fiscal future? But the bedrock of everything we do is student veterans and academic outcomes. We're looking at continuing on with our foundational work of INVEST, but also expanding it and taking it to the state level to help states better develop policies for student veterans.
Looking forward to it. From a policy standpoint, last year, I'm almost sort of hesitant to even say we have a top policy priority, because a year ago, I would have never in a million years thought that it would be, make sure 1 million students didn't lose their housing. But being realistic about it, one of the things that we have identified is that the GI Bill is truly the front door to the VA. It is oftentimes the very first interaction a transitioning service member will have with the VA. And so our priority for the 117th Congress is to make it the best and most welcoming front door that we can. The last year in particular had to be super focused on student protections and making sure that we were taking care of students in sort of the most basic way in terms of keeping housing, making sure schools weren't taking advantage of them. But looking ahead, we don't want to ignore the really important things like quickly and timely access to payments, making sure that your payment information is accurate, making sure that it's easy to access. So some of those smaller things that seem small to policymakers, but are really the most important thing to student veterans, is what we're going to be trying to focus on to make it truly the strongest most robust, most welcoming, like 3 doormats down kind of welcome that we can.
Well, Lauren, I think it's time. I see the hook coming to take us off. Thank you for partnering up with me to kind of show the behind the scenes work of research and policy.
Thank you so much. This has been a lovely conversation. I look forward to connecting with everybody in the networking lounges, and enjoy NatCon.
Yes. Bye, everyone. Networking is up, so visit the exhibit hall and reach out.